The musculoskeletal malfunctions. Possible causes and effects on the individual, monitoring, treatment and care. One malfunction of the system is osteoporosis. As you can see on the right hand side, I've included a diagram of what a healthy bone looks like and what a bone with osteoporosis looks like. As you can see, the one on the left looks much more dense with less big holes, and on the right hand side you can see it is less dense, it has big holes and looks more like honeycomb. So it's a condition when a bone strength weakens and it's susceptible to fracture. It usually affects people's hips, wrists or spines, hence the fact that as people get older they often require a hip operation. Bone density scans are carried out to assess and monitor the progress of the disease. With osteoporosis, it's often a disease where there are no early signs or symptoms, and it can take until you get a little bit older to actually notice. For example, you may have a bone fracture in an area that you didn't know you could possibly break a bone often. It may be someone who's never broken a bone before in their body and all of a sudden has broken a bone. It can start to cause, as you get older, a stooped posture, obviously praying when you have a fracture. Repeated spine fractures can lead to lower back pain. A hip fracture can occur as a slip or fall accident. I say lots of older people who have falls can break their hips fairly easy. More females than men, due to the fact that after you go through the menopause, you have less of the hormone estrogen, which then can bring on and lead to osteoporosis. So what's the biological explanation? Osteoporosis is due to the loss of protein matrix from the bone, resulting in a loss of bone density, which weakens the bones and makes them more brittle. Bones get naturally thinner with age, like I said, especially in women after the menopause. So bone density and losing bone density is associated with old age. But there can be other reasons why people have it, osteoporosis in particular. So it could be that there's a family history of it. They might drink or smoke too much. They may have an eating disorder, and even medications can cause osteoporosis. Other conditions can increase the risk, so arthritis, celiac or Crohn's disease, COPD, and even an overactive thyroid gland. If a woman has early menopause, the estrogen disappears very quickly then, and again that can increase the risk of osteoporosis. If you have a hysterectomy or a lack of periods, even if you over-exercise too much, that can make you at a greater risk. Lifestyle factors such as diet and exercise can also determine how healthy bones are. So how can it be monitored? The way in which osteoporosis is monitored is through bone density scans, which is a DEXA scan. It's like little x-rays that go through and check how the bone density and to see whether it is if it's deteriorated. This is common in people who have had been donors or had a kidney donation, transplant, sorry. So what are the treatments for osteoporosis? Well, you can take calcium and vitamin D supplements. You can carry out load-bearing exercises, take HRT, hormone replacement therapy, take bisphosphonates, slow the rate at which the bone is being broken down, taking medication for strengthening bones, having physiotherapy and using a TENS machine. We now move on to rheumatoid arthritis. So the symptoms of this can vary from person to person. They're not always the same. Often people may complain of like a throbbing pain or aching or even stiff joints. Joints can even swell and feel hot to the touch. Firm swellings called rheumatoid nodules can also develop under the skin around the affected joints. You may also notice that there may be some disfigurement of the hand. So what's happening? What causes it? So the immune system mistakenly attacks the cells that line the joints, and this is the main problem. The synovial membrane that lines and lubricate the joints becomes inflamed and sore. So if you remember going back to the synovial joints, the importance of reducing the friction by having this lubrication, if this becomes inflamed and sore, then it's not doing its job and it will affect your joints. The inflammation gradually destroys the cartilage, which is there to prevent the friction and the help reduce impact, and scar tissue replaces that cartilage and the joints become misshapen and rigid. So what is the cause? Well, it's not actually yet known. There are some theories on why people have rheumatoid arthritis. It could be from a virus or an infection which actually triggers the condition, and it causes an autoimmune response, which is when the body actually starts to attack itself. It's a bit like when someone needs an organ transplant and the organ is put into their body, the body will automatically attempt to attack it because it's a foreign item inside their body. There is some evidence that the risk of developing the condition may be increased by smoking and even by hormones, and it tends to be more common in women due to higher levels of estrogen. Again, estrogen, like bone density, plays a role in arthritis. There is also some evidence that it could be inherited, although the risk is thought to be very low as genes play a small role in the condition. What are the impacts of lifestyle on musculoskeletal malfunction? So what are going to be the impacts of having osteoporosis or having a condition like arthritis? It's about making lifestyle changes to help somebody become more mobile. They may find it hard to move around, they may require wheelchairs, or they may require mobility aids. They may need to take medication which could have side effects that may not work well with them. They may need to attend regular checkups and monitoring appointments. They may need to take physical exercise and try to be as physically active as they can. Taking care to avoid fractures, they may not be able to play contact sports, for example, may have to switch their sports to something that there is less chance of actually getting pushed or jostled around. They may lose some height. They may have to try to cope with the pain and the lack of sleep that comes with it. They may become immobile or even housebound because they're unable to get out due to the pain or the discomfort or the fact that their condition has caused them not to be able to walk like they once could. They may have to have surgery, then recover from that surgery, and they may have to adapt their home. So they may need a ramp going in and out of their home if they end up in a wheelchair, or they may need a stair lift to get up and down the stairs if it's too painful to get up and down there, or the lack of mobility will affect them.